Thank you so much for joining us this afternoon for a very important conversation. We have a very large crowd, so it's going to take us about 2 minutes for everyone to come into the room. You'll be able to use the Q&A function to ask questions. Feel free to begin posting your questions anytime. If you're just tuning in, thank you so much for your patience. In about a minute and a half, our program will start. You can use the Q&A function to pose questions to Dr. Ferrer, and that's available now as you wait. If you're just tuning in, thank you so much for your patience. About 1 more minute, we'll start our program. Feel free to use the Q&A function to pose your questions. Hi, good afternoon, everybody. It's great to have you with us tonight. We have a very large crowd, and we'll get to as many questions as possible later in the program. I just want to remind you all that next week's program, it's a blockbuster program on election reform with Benjamin Ginsburg and Rick Hasson and Pam Fessler. It's on Tuesday night, not our usual Wednesday night. So just make sure when you calendar it, you know that it's not our usual time. And it's certainly been an incredible week since just 7 days ago when we were together last. Now I'd like to welcome Mel Levine of our governing committee to be able to give further introductions tonight about our program. Mel.
Thanks so much, Janice. It's a pleasure to welcome all of you here once again to our America at a Crossroads series, our weekly exploration of where our nation is and where we're going with some of the country's most thoughtful and analytical leaders and thinkers. As Janice just mentioned, this is the second town hall we've held this week. Our memorable Sunday night discussion with the New York Times' Peter Baker and the New Yorker's Susan Glasser was superb. And despite this frequency, you, our audience, have been deeply engaged. Between our two programs, within 4 days, we will have nearly 10,000 viewers. I'm speaking with you on behalf of Jews United for Democracy and Justice and Community Advocates, Inc., the creators and hosts of this series, and our leadership team, Zev Yaroslavsky, David Lair, Rabbi Ken Chasen, Carolyn Kennedy, and Janice Kaminer-Resnick. And I want to thank, in particular, David and Janice and Zev for their extraordinary engagement in these programs. Our co-sponsors are ICAR, Jewish Center for Justice, Leo Beck Temple, Stephen Wise Temple, Temple Israel of Hollywood, Valley Beth Shalom, Temple Beth Am, Temple Isaiah, LA Museum of the Holocaust, Pico Union Project, and our newest partner, the American Jewish Committee, Los Angeles. The past 10 days have been unparalleled in America. The president fomenting a coup and then being impeached exactly 1 week later with bipartisan support. But the public health world has also been deeply disquieting. The United States, and most especially Los Angeles, has been reeling from the resurgence of the COVID virus. Considering what has transpired, we're beyond fortunate tonight to have one of the most respected public health experts in America joining us, the director of LA County Department of Health, Dr. Barbara Ferrer. Dr. Ferrer will be able to help offer us an up-to-date accounting of where we are and where we are going and what you can do. And now my partner and very dear friend, Zev Yaroslavsky, with whom it has been a pleasure to collaborate these past 10 months, will introduce our guest and our moderator. Zev?
Thank you, Mel, and thank you to our audience for your interest and your constant support. I want to make, and to Dr. Barbara Ferrer for agreeing in what is an incredibly difficult schedule to spend this next 55 minutes with us. Barbara Ferrer is the director of the Department of Public Health in Los Angeles County, which protects and promotes health and prevents disease among Los Angeles County's 10 million people, the largest county in America. Prior to arriving in Los Angeles several years ago to take this post, she served as the Chief Strategy Officer for the W.K. Kellogg Foundation. And prior to that, she served as the Executive Director of the Boston Public Health Commission, among other things. Dr. Ferrer has the challenging job of directing America's largest county's response to the COVID pandemic. As most Americans know by now, Los Angeles has become the epicenter of COVID-19, where nearly 1 in 10 residents have been infected with the virus, and over 250 people a day are dying of it. Needless to say, the entire country is focused like a laser beam on this issue, as evidenced by the more than 5,500 people who registered for tonight's program, our largest audience ever. And to lead our conversation tonight is Larry Mantle, who needs no introduction, as he is a fixture in all of our daily lives here in Southern California. Larry has been the host of Air Talk on NPR's member station KPCC since 1985. Air Talk is the longest running daily talk show in Southern California. He is known for his kind yet probing and incisive interview style. A fourth generation Angelino, Larry has interviewed thousands of prominent guests on an extraordinary array of topics and received many journalistic awards in the process. Welcome back to America at a Crossroads, Larry. And now I want to turn it over to you and to Dr. Barbara Ferrer.
Larry, you're muted.
Zev and Mel, thank you so much. It's a pleasure to be with you and to be back for America at a Crossroads, and to see the extraordinary degree of interest with more than 5,000 people taking part in this program. And I know that for many of you, you're viewing this from across the United States and around the world. I want to encourage you, when you ask a question, to put your location, where you're watching this from, whether it's in Southern California from where we originate, whether it's in New York, Montana, or in Australia, as we had a question the last time I hosted one of these. So we look forward to hearing from you via the questions. Obviously, in the limited time, we'll just get through whichever ones that we can with Dr. Ferrer. Dr. Ferrer, thank you so much. We appreciate it. Let me begin, first of all, with the word that we got today, that people 65 and older can now be vaccinated. But does Los Angeles County have enough vaccine to vaccinate all the healthcare workers and everyone 65 and over?
Yeah, thanks so much, Larry. I also want to extend my thanks and deep appreciation to Zev and Mel and Janice for inviting me here. I'm deeply honored to be with all of you this evening. And thank you so much, Larry, for agreeing to be our moderator and our host. I look forward to sort of answering as many questions as possible. And yes, it's a good place to start. CDC, the Centers for Disease Control, which is our national public health department, announced yesterday that everyone should begin working on getting vaccinated. Everybody who's 65 and older. If you look at who passes away, unfortunately, in our country, and here in LA County, 80% of the people who are dying are people who are older. And I understand the urgency, probably more than any other county in the United States, with making sure that we're reducing the number of people who are passing away every day. Here in LA County today, I announced another 280 people had passed away. That's really one person every 5 to 6 minutes dies from COVID-19. There's absolutely no other disease that we've ever experienced for the last many, many decades that has this high a mortality rate over such a long period of time. We have more people dying every day in LA County of COVID-19 than we have dying of every single other cause of death combined. So it is very important that we have a strategy for vaccinating those people who are at highest risk, and that does include people who are older. We have to temper that with this obligation, as you noted, Larry, to finish vaccinating all of the healthcare workers here in LA County. And that's as many as 800,000 healthcare workers. And no, LA County has not received 800,000 doses of vaccine yet. And as part of our allocation, we are actually in the process of giving everyone their second dose, which really means for 800,000 healthcare workers, you need 1.6 million doses of vaccine. And we're nowhere near that. So we're going to have to work closely with the state and our federal partners so that we're able to finish vaccinating the healthcare workers. We absolutely need them to remain healthy because they take care of all of us.
Let me just interject here,
Sure.
though, because the frontline healthcare workers, those who are in direct contact with patients who have the coronavirus, haven't those individuals been vaccinated at this point? And my understanding of the federal guideline was that this was to go into effect immediately. It wasn't to wait till everybody who works in a healthcare setting is vaccinated before 65 plus get it. It's that as soon as the frontline people who are at very high risk are taken care of, then you move 65 plus.
Yeah, it's such a good point, Larry, but I'm not sure how accurate that is. Within what's called phase 1A, our healthcare workers, all who have an exposure because of their work to COVID-19, that would include the custodians, that would include your receptionists. All of those folks come in contact with patients and can in fact become infected themselves. So I think frontline healthcare worker really is fairly expansive. One group that I think most people sort of haven't considered is all those home health workers that go into people's homes, that take care of people who are sick and need care in their home settings. Those people all need to get vaccinated. People who are working in our laboratories, oftentimes, really doing all the testing on COVID samples, they need to be vaccinated. People who are our vaccinators need to get vaccinated. People who are working on the front lines doing testing need to get vaccinated. So I think there was an intent here to get to, as you talk about it, the frontline healthcare workers, defined to include people who keep our facilities, that are healthcare facilities, operational, and those who actually do direct patient care.
So
and in
which
LA County, it's lots of people.
Which hospitals have not been able to vaccinate the custodians, the people who are interfacing with COVID-19 patients, the laboratory workers dealing with samples to be tested for COVID? Which hospitals are those have not yet been vaccinated in those groups?
Yeah. So the 82 acute care hospitals in LA County that treat COVID-19 patients pretty much have given all of their healthcare workers and frontline workers that have an exposure their first dose. They still are obviously completing that second dose. If you receive the Pfizer vaccine, your second dose will come 21 days after your first dose. So they're not done because most of them are still doing their second doses. But we have all the private providers, the private practitioner, our federally qualified health centers, all of our clinics, specialty clinics, everybody who seeks care, who works for care at our residential treatment facilities, at our psychiatric urgent care centers. We have thousands and thousands of healthcare workers that are not in the acute care hospital network that need to get vaccinated.
What is the rationale, though, for vaccinating people, say, working in psychiatric facilities, providing psychological care, drug treatment, things like that, ahead of people that are 65 and over? Because presumably the people at greatest risk who are drug counselors, for example, or psychologists working for a public health entity, if they're older than 65, they can get vaccinated. If they're younger, presumably their risk is going to be less than a typical 65-year-old. So why would those people be prioritized?
Well, I think risk is relative. So I would say that people who are working with patients and providing a lot of direct care, or working in settings where there's a lot of direct care with patients, And everywhere you go in LA County, there are people who are infected with the virus. Those people do need to be protected. That decision to create in that first priority group, healthcare workers and residents of long-term care facilities, that was a good decision in my mind. I think that's an accurate.
I don't think anybody's arguing about long-term care facilities. That's about as high risk as you can get. How far are we away from those people that work in those settings and the residents of those facilities being fully vaccinated?
Yeah, so there's two strategies for completing vaccinations of both residents and staff in long-term care facilities. One that was set up by the federal government, which is called the Federal Pharmacy Partnership. And CVS and Walgreens have a contract to go out to the 3,000 plus long-term care facilities here in LA County and schedule appointments to go to those facilities and vaccinate residents and staff that are working there. That program is just starting now for those long-term care facilities. Because there was such a lengthy startup for that program, that federal partnership, here in LA County, we took out of the federal partnership all of the skilled nursing facilities. That's 340 skilled nursing facilities. We started vaccinating there at the end of December. And I would say at this point, it looks to me like about 67% of residents and staff at the nursing facilities have been vaccinated. Some of the people who haven't are people who have appropriately decided that they don't want to get vaccinated at this moment, or they may in fact be infected and positive for COVID-19 and not eligible for it. But we've made great inroads at the skilled nursing facilities. That federal partnership has promised the state that they'll be well on their way to completing vaccinations for that first round at all of the congregate living, at all of the long-term care facilities within the next few weeks.
You mentioned about the second dose going to healthcare workers, but my understanding of the directive from the federal government was that not to hold back for the second dose, to keep those in reserve, to instead vaccinate as many as people as possible with the first dosage of the vaccine. Is that being done here?
Yes, nobody's holding anything in reserve. What we've been promised is that when we get an allocation for a first dose, when it's time for that second dose to happen, we will get the subsequent allocations for those second doses. So we have given no instructions to anybody to hold anything in reserve. Every dose that's out there needs to be administered as quickly as possible to folks who are eligible for getting vaccinated. Right now, we're in phase 1A. But I think your initial question was a good question, Larry. There is urgency to get to people who are older. I think we can accomplish both. We can get our healthcare workers vaccinated in the next week or 2 weeks, and we can set up the system for vaccinating people who are older. I will say that there's different systems here, though. People who are older, we need to set up call centers so that people can actually call and register. Right now, the system is an online registration system, and you have to be registered. So we need to help make sure that there's no obstacles here. We're not making it hard for people. We really don't want older people to be waiting on either long lines or in their cars for hours to get vaccinated at these larger sites that sometimes get set up in large, what we call our large vaccination sites. So we've been enrolling as quickly as we can, because again, these folks need to be registered and approved. Pharmacies and primary care providers. The easiest place, I think, for many older people to get vaccinated and where they'll trust getting vaccinated is with a trusted healthcare provider. But every single provider that wants to vaccinate needs to get registered and approved so that we can distribute vaccine to them and they can go ahead and vaccinate. So
well,
that's
going to take. But isn't that going to take forever if you're talking about distributing to every healthcare provider so that they can administer the vaccine?
No, there's an online system for them to register. It went live today. There was an older system. So we have hundreds of pharmacies already registered and approved. And many of the larger healthcare providers, the larger clinic sites, the larger practice sites are also already in the system. But again, I'm saying, the best way to do this is to build out the private and public partnership model that makes it easy for older people to get vaccinated.
So is there a central, if people right now watching want to sign up, they're over the age of 65 and they're Los Angeles County residents, can they go to the county public health website and be able to register and then be contacted as soon as they're able to, the vaccine is there for them?
Yeah, you can go to our site and you can register. You're not making an appointment yet because you're not necessarily in the priority group at the moment. It's healthcare workers, but you can register and we will send you an email to let you know when it's your turn. And then you'll be sent the link to go ahead and register online if you're able to. As I said, we're going to build out a call center capacity so that people who can't or don't have access to online registration for their appointments will be able to do that over the phone. But those are systems that have to get built this week.
Okay, so you can't do that right now, you're saying?
You can sign up on our website and you can get a
Okay.
newsletter from us and we can give you an alert when it's your turn.
Okay.
Yes, you can do that.
And I'm still trying to get my head around the different tiers here, because you mentioned 1A, which are the healthcare workers, but then you mentioned everybody who works in healthcare.
Yes.
And then we've got the 65 and over. So I'm confused where the previous tiers sit and
Yeah.
where the 65 and when does 65 and over kick in?
Yeah, it's a very complicated system. So it's done by what are called phases. Our first phase is what we call 1A, phase 1A. That's where we are right now. Frontline healthcare workers, those who work in healthcare facilities and have exposures, and people who live and work in long-term care facilities. That's 1A. We move from 1A to what we call phase 1B. We anticipate being here at the end of January, the beginning of February. The state today announced that they have reprioritized the ordering of people who will be eligible to be vaccinated as part of phase 1B. At the top of the list are people 65 and older.
Okay,
After,
so 1B has been changed.
Yes.
And does that include people with comorbidity, people with hypertension, diabetes and the like? Are they included with the 65 plus if they're under 65 but have comorbidities?
No, at this moment, the priority group at the top of the list for 1B is people 65 and older. And obviously that includes people 65 and older who have underlying health conditions that put them at greater risk. After that are 3 groups of essential workers, starting with education and in no priority. But 3 groups of essential workers will then be eligible for vaccination in phase 1B. And those will be workers at education and daycare sites. Those will be workers in food and agriculture. And those will be workers that are part of public safety, first responders.
So the 65 plus does not include people under 65 with serious health challenges. I thought that was part of the federal directive, was that those people with comorbidities would also be included, but that's not the case?
That's not what the state
Okay.
has set for the
Okay.
prioritization. So, and it's probably helpful for people to understand, the CDC makes recommendations. The states take those recommendations and turn them into a framework for prioritizing vaccinations. And then the local health departments are asked to follow that prioritization and implement. So our job is really to figure out what systems we need that will reduce as many barriers as possible for those priority groups to go in the order that the state suggests and get vaccinated.
So this pushes teachers and childcare workers further back in the line as the 65 plus individuals have now moved in front of them, correct?
Yes, and there's always questions about sort of what that tiering looks like. So within each phase, you're right to note that there's a tiering. The first group we've been told is to prioritize the 65 plus. Oftentimes within the tiering, you start with that group, like we started with acute care hospital workers, because that was where the most vulnerability was. And then even within phase 1A, we had, as you noted, tier 1, tier 2, and tier 3. At a certain point, it just became everybody who was in phase 1A would be eligible for vaccination. And my assumption is We will start tier 1B similarly, trying to prioritize those at the beginning of that list. But at a certain point, if there's enough vaccine available, we would be able to move very quickly to opening up for all the tiers under phase 1B. And then, of course, we move to phase 1C. So, again, we work closely with the state. We adhere to what the state asks us to do, and then we try to make sure we're implementing. And for all of us, getting more vaccine will be key to actually moving through this fairly quickly.
Dr. Ferrer, walk us through what this is going to look like. So let's say a viewer gets off of this program at the end, goes on the LA County website, registers, as you suggest. You mentioned they're going to get a newsletter after that. So what can she expect after she signs up? What do you think is a reasonable time frame for her to get the response? And what is it going to direct her to do? Will it say contact your local CVS? Will it say call your primary care provider because she has vaccine? We know that she's got it. It's confirmed. She's good to go. Make your appointment. What are the specifics that person's going to get?
Yeah, the way the system works right now for healthcare workers is they're directed to our site, and then they're directed on our site to go and set up an appointment. And when you go into the state program for registering for appointments, it's a patient appointment scheduler. You're given your options. It tells you where throughout the county we have appointments that are available where you can register to go ahead and get your appointment. It doesn't, it tells you that you have to obviously be in the appropriate group. We try to message a lot that the appointments now are for healthcare workers, but then you just sign up. You give the information that they ask for, your name, your address, some contact information. You get verification that you have an appointment, and you're told where exactly your location is, and you're reminded to bring your verifications.
So you won't be going to your own personal doctor. It may have a private physician that you see for getting your injection, but it has nothing to do with your own healthcare provider.
Well, our hope is that when we get to 1B, you can go to your private doctor, and you'll still need to, when you go to your private doctor, they'll still need to register you through a patient portal. But the easiest way to do this for thousands and thousands of people to quickly get vaccinated is to have, as I noted, those private providers registered, so they can in fact say, send you a note. Oh, I'm a Kaiser patient. What I would expect from Kaiser is at some point, they're going to send me a note and they're going to say, yeah, Barbara, it's now your turn to get vaccinated. Here's how you can make an appointment. And here's where you're going to go to get your vaccine.
So the county registration then is independent of that, it sounds like. Is that in essence the backup in case you don't hear from your primary care provider?
Right now, because we don't have all of those providers registered, it is the only registration system is this patient portal. And that's why I'm saying for healthcare workers, you're going to our website, you're signing up for an appointment. Unless you were vaccinated at your hospital, in which case it was all taken care of at the hospital. But for everybody else, you're going to the website, you're being asked to register. Now you can get vaccinated right now at 75 different sites across the county. A lot of those are pharmacies. So they're all over the county. Starting on Tuesday, we start with these big vaccination sites where at each site you can do 4,000 people a day. Dodger Stadium opens up on Friday. That's run by the city. That will have capacity for 6,000 plus a day. But all of them require patients to go to the portal, sign up, and get an appointment. You can't just show up at the site.
So I thought you said earlier that at this point you register at the county site, they send you a newsletter, but you can't make an appointment yet.
Unless you're a healthcare worker. If you're a healthcare worker, you can make an appointment.
But most of them are getting it at their place of employment, right?
No, probably half of them can be offered vaccine at their place of employment. They work in a large enough entity that's receiving vaccine and is able to vaccinate. Many of those.
I'm sorry, go ahead.
I'm sorry, it's super complicated, and
Yeah,
I
it
appreciate the
is.
questions, Larry.
Why does it have to be so I guess, you know, there've been months to set up a system that incorporates private physicians and dentists to give we've had months to set this up, to vet those places, to have a place that as soon as they have the vaccines ready to go, why is that system not built?
Well, you know, I think if you look back in hindsight, there was a lot of money that was given to actually the researchers and the scientists to develop the vaccine. There was no money given to public health to build out any systems for administering the vaccine. We got a few $1 million to try to massively, across the state, to try to build this massive vaccination system. So I think one issue has been the resources. And particularly what you're talking about is like, how come we weren't able to register everybody ahead of time? The state did their very best. They designed a system. It didn't work so well, and it had to actually get redesigned because it couldn't handle the volume that was needed. But I'm not trying to apologize. I'm just trying to explain. There were limited resources that were given. There was no federal plan that actually went out to any of us, not to the states or to the counties, about here are the steps we need you to do. Here's your toolkit. As a matter of fact, a lot of systems were set up that went completely around health departments, like the federal pharmacy partnership with CVS and Walgreens to do folks in long-term care facilities that never really launched when it was supposed to launch. In fact, those Walgreens and CVS pharmacies get their allocations directly from the feds. They don't go through the county allocation system, and they set up their appointments completely independent from what the county is doing. So I think some of this is to be expected. This is the biggest effort this country will ever have made on trying to vaccinate this many people over such a short period of time, with all of the uncertainties that were in place and in play around when the vaccine would become available, and then how would it be administered, the fact that it's 2 doses, the fact that one of those vaccines requires a deep freeze capacity. I mean, these are all issues that there actually hasn't been as much time to figure out how to manage all of that as you know, you would hope we had had. But I hear you. I wish we were in a different place. I understand the frustration, but the real issue, like we could get caught up in like the systems aren't working. The real issue is we don't have enough vaccine. So I just want to go back to that. Because you can have every system, you can have every system in the world right now, and we do not have enough vaccine. I personally don't have enough vaccine here in LA County to actually give vaccine to every site that is set up to vaccinate next week. I have to negotiate now with the state to see whether we can get all the doses that we need to make sure that everyone who has an appointment next week is actually going to get vaccine in their arms. And that is not the state's problem, and that is not the locals' problem. That is a problem at the federal level. We have no idea when the vaccines are coming and how much we're getting. And that has been the story since the beginning of December.
And I ask you this not to place blame or to say what's wrong with your office. That's not why. I'm just trying to understand, because I think for so many people, and you hear this all the time, there's tremendous frustration about the lack of systematic information that's well organized, that has a coherent message. Because if you tell, if people at least know, okay, here's where you're going to get your vaccine. Here's how it's going to happen. We think the time frame is between 1 and 3 months. And here's who's going to contact you. Here's where you need to go. But I bring this up because I think that's the messaging that for many people, they haven't heard that. And that's a huge vacuum at a time like this.
Yeah, I totally agree. And if you think about how we distribute almost all of our other vaccines, we don't do it this way. You're absolutely right. We don't ask a provider who's already a licensed medical provider and supervises people who are approved to be vaccinators. We don't ask them to go register and get an approved application in order for them to be able to distribute the measles, MMW, the MMR vaccine, or we just don't do it that way. But we have this whole new system now. And it is creating, as you noted, some unanticipated obstacles and barriers that's taken us longer to put in place what will end up being, I think, a robust private-public partnership. But I want to just say, like, that is not the big issue right now. The issue is not the system. I understand what you're saying. People are confused as we try to develop the system. But the big issue is we don't have enough vaccine to vaccinate everybody who wants to get vaccinated right now. We just don't.
So why the announcement about that people 65 and older can now get vaccinated since they can't get vaccinated?
That was an announcement that was made by Secretary Azar at the end of his administration, with no plan in place at the local level or at the state level for actually figuring out how we were going to do that, and frankly, without enough vaccine. So
I thought, though, that Governor Newsom said that this morning.
no,
that-
the announcement first came from the secretary.
Yeah.
And, you know, telling everybody that it was time to vaccinate everybody 65 plus. And, you know, I understand, you know, how important it is to vaccinate people, but I also understand that the reality is if you're going to put that out there, you have to have enough vaccine.
Let me ask you about schools, because Austin Butner, the superintendent of the LA Unified School District, said on Monday that once the vaccine is approved for kids, that it's going to be mandatory for students if they return to campus, just as MMR, the other vaccines that you mentioned, childhood vaccines. But I would assume, just like with adults, it's going to be emergency use authorization from the FDA, not the kind of authorization that those childhood vaccinations now have, because we have years of data collection on those. So do you think it's right, before we have a full-blown authorization, to require kids to be vaccinated against the coronavirus before they come back to campus?
Yeah, I would agree with you, Larry. It's really important to remember that these vaccines are being authorized under emergency use authorization, which means that they don't have all of the scientific studies behind them that would allow them to have the full license, as most of our other vaccines, as you noted, already have. And we've certainly said that, you know, from a public health perspective, it wouldn't really make sense to mandate a vaccine that's under emergency use authorization. I think we'll need to wait until they're fully licensed products.
Let me ask you some of the questions from people who are attending our program. Let's see, this is from, let's see. Sorry, I went too far back here. We have a question about, do you think it makes sense to give the vaccine? This is Eli asked, instead of holding back the second doses. Does that make sense to you? Just counting that those second doses are going to be available in the future when needed.
Yeah, I mean, I think we have to go that route. Everybody knows when you give us a first dose that we count 21 days later, if it's a Pfizer vaccine, on having that second dose. I do want to note that if you didn't get the vaccine on day 21 and you got it on day 24 or day 25, that's perfectly okay. But you do have to have a system that's set up that actually lets people know I got my first dose and now I'm getting my second dose. I know that the FDA has clarified for everyone that there is no recommendation to forego the second dose, because I think people have also heard, well, you know, let's just give everyone the first dose. It gives you, you know, maybe 50% protection and not worry about getting the second dose. The FDA has made it clear that under the emergency use authorization, both these vaccines are 2-dose vaccines and everyone needs to get the second dose.
SCS says, my mother's 95, lives at home with her caretaker. How can she get the vaccine? She's not on email to register. SCS doesn't say whether there's a visiting nurse who goes to the house or how the mother's healthcare is handled, but any suggestion on that?
Yeah, you know, these are the questions of the system that actually needs to sort of embrace all of these unique situations. I'm assuming that, I'm not sure about SES's mom and whether she is mobile or not mobile, but let's assume she's not mobile, because I think that's a group we have to pay attention to. If she has a caregiver and the caregiver is qualified to vaccinate, then the easiest way for her to get vaccinated is going to be through a qualified healthcare worker. But we will need to work with our visiting nurse associations and our home care agencies for those folks that have no mobility to make sure that we've got a system in place where they're able to be vaccinated. And again, I wanted to note that one reason why we need the call center and not to, force everyone to an online system that's not going to work is, the daughter of a person can feel free to call and try to make that appointment. Our hope would also be that most people are connected who are older with a primary care provider, and that we can work a lot with their primary caregivers and their primary care providers to both get them registered and get them vaccinated.
What's the timeline for the call center being established? And you're going to have to hire a lot of people, right?
Yeah. Well, we already have pivoted. We'll have our call center open, I hope, next week. And then the state system for patient registration also has attached to it a call center function. So the state will also be setting up a call center, and we will set up a call center. The purpose of ours is really to help people register. The states might be more to do some troubleshooting as you're online. But I think between the two, we're going to make sure there's capacity for people to register. And again, ours, hopefully, we're training everybody this week, and we're pivoting some people into that task who are doing something else so that we'll have immediate capacity next week.
Can people be vaccinated across county lines? In other words, if I'm an LA County resident, can I be vaccinated at Disneyland, or someone who lives in Anaheim be vaccinated at Dodger Stadium?
Yeah, I think Disneyland already said, I think that's Orange County, right? I think they already said you need to establish your residency if you're going.
In Orange County.
Yeah, you'll have to be a resident there. I do want to say for us with healthcare workers, it was if you work in LA County as a healthcare worker, you're getting vaccinated. We're not sending you back to where you live. So if you're working here, and I would imagine that same rule will apply for essential workers, because as you noted, for a lot of folks who are at work, the easiest way for them to get vaccinated may be at their work site. So we're not going to say, oh, you live in LA, you get vaccinated. Oh, you work here in LA, but you don't live here, you don't get vaccinated for those essential workers once it's their turn to get vaccinated. But I do understand that when you open up these very large vaccination sites and they're open to the public, they're not so constrained, you may be asking for some form of verification of residency. We're not there yet. Right now, what it really is those sites are open for healthcare workers. And if they work anywhere in LA County, they're eligible to get vaccinated.
Jerry says he's a veteran and he wonders, is there a separate VA system?
Yeah, the VA actually does have a separate system, and they get a direct allocation from the federal government. They don't go through the state or the county system. So I'd urge veterans to contact the VA about the opportunities that they're offering for you to get your vaccine.
Barbara wants to know the websites, the LA County website, and do you know the state website for people to register? Is it easy to find?
It's very easy to find if you go to our website, which is www.lacounty.gov. And there's a direct link there to our website and to all, we have also a lot of information for people who have questions about the safety of the vaccine, who should get vaccinated, who may not want to get vaccinated or not feel comfortable getting vaccinated. What are some of the side effects you can expect if you get vaccinated? Like, there's lots of good information on our website. So please feel free to visit it and visit it often.
Sam asks where childcare providers are in the priority list. I think you said they're with teachers, right? So they're after 65 plus. They're after that group. Okay.
They're a priority group under 1B and Tier 1.
All right. We have a number of questions about the different manufacturers of the vaccines, Pfizer versus Moderna versus the potential Johnson & Johnson, which has not yet received emergency use authorization. We have the AstraZeneca Oxford one that again is awaiting emergency use authorization. People want to know, are there difference in the effectiveness of those vaccines or the safety of them?
Yeah, it's a really good question. So the only two vaccines that we could really talk about right now, because they've had an emergency use authorization and we've seen their data, is the Pfizer vaccine and the Moderna vaccine. Both of those are vaccines that use a slightly different technology than what has traditionally been used to manufacture vaccines. They use an rDNA technology, so they're very similar. The biggest differences between the Moderna vaccine and the Pfizer vaccine is the Pfizer vaccine was approved for emergency use authorization for 16-year-olds and above, and the Moderna vaccine was only approved for 18-year-olds and above. That's really reflective of who was in the study population. You know, those clinical trials that they did with thousands and thousands of people to establish the effectiveness and the safety of the vaccine. So there's a slight difference in who can get vaccinated in terms of younger people. And there's a slight difference in when you need your second dose. For the Pfizer vaccine, you need to get that second dose 21 days, around 21 days after your first dose. For Moderna, you get that second dose 28 days. But they both use the same technology and the same delivery system for having your body mount a response that will then help you. As both of these vaccines, what they help do is they help prevent you from getting ill from COVID-19. At this point, there's not enough evidence to know whether they prevent you from getting infected with the virus and or prevent you from infecting others. So right now, everybody who gets vaccinated, while you have some security that should you become infected, you are very unlikely to become seriously ill from COVID-19. We do not know whether you can become infected, be asymptomatic, and spread that infection to others. So you're still going to need to wear your face covering, keep your distance when you're out and about with other people, because that information's not known yet.
What do you say to, younger people who say, well, if I'm still going to have to mask after getting vaccinated because it's unclear whether there's shedding of the virus by people who are immune through vaccination, then why get it? The odds that I, as a younger person, are going to have complications, that I'm going to even be symptomatic, and if I am, that it won't be gone quick. What's the point of going through the vaccine if it's not really going to change how I live my life?
Yeah. It's such a good question. And I think there's probably two important points to keep in mind. One is younger people are actually at sort of the tail end of the priority list of people who will get vaccinated, unless they have underlying health conditions, in which case they're a group of people that want to get vaccinated because they're likely, if they get infected, to actually have serious illness. The other thing is the only reason we don't have the answers to these questions yet is because there just hasn't been enough time to follow the people who were in the studies and were vaccinated in the fall. But as there's more information about the people who were in the study, we should be able to get answers to those questions. So I would anticipate by the time it's the turn of a young person who has no underlying health conditions to get vaccinated, we'll have much more information about how much protection this vaccine affords everyone, not just from getting sick, but from actually spreading the virus.
And how will we know that? Contact tracing isn't particularly robust. That never has really taken off. We don't really know beyond surmising from what people seem to be happening, like larger family gatherings spreading and the like, super spreader events. So how will we know about the virus shedding? In other words, the idea that someone vaccinated, immune system strong enough, they're exposed, they don't get sick, but there's enough of it that perhaps there's still shedding it off to other people. If we can't trace it, how will we know that?
Yeah, I think both Moderna and Pfizer have really extensive research studies built around this. So you're absolutely right. The kind of contact tracing we do as a public health department wouldn't answer the question, but the kind of contact tracing and follow-up that they're doing with patients in their studies will answer these questions.
Ellen asks, are the vaccines safe for pregnant women?
Mm-hmm. So the studies, there weren't enough people in the studies that were pregnant, so it wasn't studied enough to ascertain whether or not, well, they can't really answer the question, so because there weren't enough people in the studies. So the advice we're giving pregnant women is that they need to talk to their providers about making that decision about whether or not to get vaccinated, because the amount of folks that were enrolled, they just didn't have enough pregnant women to be able to answer with 100% certainty about safety for pregnant women. So if you look through the literature on the Pfizer vaccine and the Moderna vaccine, they suggest that pregnant women should in fact consult with their providers. To date, they have no evidence that it's not safe, but they didn't have enough people enrolled to actually answer the question with enough rigor.
One of the questions we get almost daily on our Air Talk radio program in Los Angeles is, if I've had COVID-19 and a likely immune response from that, should I still be vaccinated afterwards? And can you explain a bit why that is still important for people?
Yeah,
to be
so
vaccinated?
the answer is still yes, because we have no idea still. Again, this is a brand new vaccine, so we don't know everything we wish we knew about COVID-19. But what we do know is that there's not 100% certainty that just because you were infected with COVID-19 that you have protection against getting reinfected. As a matter of fact, we have some cases where it's been established that people have been reinfected. And we certainly don't know how long any sort of immunity is lasting. So because of that, yes, if you've, unfortunately, you already were sick or you were positive for COVID-19, as long as you're past that isolation period of 10 days and you're symptom-free and fever-free for at least 24 hours after those 10 days, you should go ahead and get the vaccine.
We have another viewer who asks, since we are in by far the worst period of COVID-19 cases and the biggest capacity challenges at our local hospitals, why haven't we closed malls, indoor shopping, things that were closed early on in the pandemic when we had less demand on hospitals?
Yeah, it's such a good question. And, you know, I'll just start by saying that obviously as a health department, we are looking at whether we need to take some additional steps. You know, our hope was that we would actually at this point start to see a decline. But without seeing that decline, this is a very fair question about, do we need to do more? And in particular, I think it's a fair question because no matter how you look at this, spread happens when people are around other people not in their household. And even sometimes spread happens when people go outside of their household and then come back to their household. So it's really important at this point that we understand that with this much community transmission, when we start saying, you know, that 20% of the people who are testing on a given day are testing positive, that used to be 3% back in November. That was, you know, you went and got tested. Out of every 100 people that got tested, 3 people had a positive test result. Out of every 100 people that are getting tested today, 20 people are testing positive. So that shows you how much community transmission we have. And we are looking at that question. The reason why we issued health officer orders that look slightly different in this last go round was we understand a lot more about the virus now than we did when we closed everything back in March. At that point, we really didn't know exactly what we were dealing with. And we didn't really know exactly what tools were going to be available to protect folks. But we now have a lot more information, and we know a few things that I think are really important. If you have people that are wearing their face coverings appropriately, and that means over the nose and mouth, fully covered tightly, and you have people that are keeping their distance from each other, it's an and, not an or, and you have a lot of infection control going on at sites where people may be together, like a work site, you can in fact reduce transmission by a lot. By a lot. These are very powerful tools if they're used all of the time and appropriately. So what we did in the second go round was we basically said, okay, we have all these directives now that tell you at work sites, these are the things you have to do to create safety at the work sites. What we don't want is we don't want people mingling with lots of other people in crowded situations, particularly indoors. So you notice, yes, the malls are open and the stores are open, but at 20% capacity to avoid overcrowding, to give plenty of space for people. And with, you know, absolutely from us, an encouragement that, you know, if you don't need to go shopping, don't go shopping. I must say that every single time I talk with the press. Like these retail establishments are open. It's very hard to distinguish between essential goods and non-essential goods, but they're at 20% capacity unless they're a full service grocery store. And there's a reason for that, because we don't want a lot of people doing that shopping. So that was the intent behind all of this, was have no places where people are going to be intermingling where they're not wearing their face coverings. That was why outdoor restaurant dining and indoor restaurant dining got eliminated, because in order to dine, you have to take off your face covering. And you're sitting there with people not in your household. There are workers that are then also exposed because you're not wearing a face covering. So there was this effort to sort of use the new science we had to craft a more tailored and specific set of modifications on this go round. But if it's not working, and it might not be to as great a degree as we now need, we may need to go back and revisit that and, again,
But
reduce more opportunities where people might be mingling with others outside of their household.
the problem remains, doesn't it? We don't have the degree of contact tracing to really know how many people are contracting it when they go to a mall, how many people are getting it when they're doing their weekly shopping at the grocery store, how many are doing it from unmasked extended family birthday gatherings that they think are safe because, well, it's family, even though they don't live together. We can't really quantify this, right? So doesn't it make it difficult to then precisely craft the kinds of guidelines that are going to keep people safe and that people will have confidence in?
Yeah, it's such a good point, and we obviously get tied up with this question all the time. The science is really, really clear. If you have a face covering on and you keep a lot of distance from people not in your household, there's much less likelihood that you will infect somebody else and that somebody else will infect you. So I hear you that wouldn't it be nice if we knew where I got infected, but it's a 14-day incubation period. That's a really long time before I might test positive. And so it really means it's really hard to go back 14 days and say, oh, I went to the grocery store and I also went to the cleaners. And yes, I had to go to the doctor's office, and I went for a walk at a park. And, so you can see over 14 days, you've done a lot of activities. If some of those activities weren't done with a lot of safety, you risked exposures. I went to dinner with a group of friends at their house. Obviously, we didn't have our face coverings on. The easiest way that we've been able to track that there's a lot of spread is we do workplace outbreaks. So we know when workers are becoming infected. And many times we do contact tracing. If somebody knows they had an exposure, they often say to us, oh yeah, I know where I got this from. I was at a party. I went to a friend's house. I'm at work and there's a big outbreak at my work. And then you have that certainty. But without knowing that, we still know enough to say, if you wear your face covering, if you're not in crowded situations, if you keep your distance, and you use all that hand sanitizer and wash your hands, you have a lot of protection. It's when you can't do those things or don't do those things that you create those risks of exposure.
Dr. Ferrer, thank you so much. I know you're so busy and have to run. We really appreciate your taking this. And I hope you know, in asking these questions, we understand the kinds of incredible, well, we can't really understand. We have an idea of the kinds of challenge that your department is under, and we appreciate the work that all your staff and all the people in healthcare are doing in county public health offices across the country. So thank you for your work. We very, very much appreciate it. If we could get the two websites again for the LA County and state of California for people to register.
Yes, I don't have the states, but ours is www.publichealth.lacounty.org. So please go there. You actually can get a link from that site to the state site.
Great. Dr.
And
Ferrer.
I want to thank you, Larry. I want to thank Zev and Mel and Janice again, but mostly I want to thank everybody who joined us for the conversation. I want to also express my gratitude and appreciation to all of you. This has been a very long year, this past year. We have a ways to go. The vast majority of folks have done everything they could to prevent transmission. And we appreciate all of you for your contributions to helping us slow the spread. We are here to answer questions, and I appreciate that the questions are tough because it's very, very complicated. This is a complicated virus. We don't know everything we ought to yet about it because it's new. And unfortunately, it's very easily transmitted from one person to another. But thanks a million for everything you're all doing to keep each other safe.
Thank you, Dr. Ferrer. We appreciate it. And I just want to remind those of you who are regular attenders of these important events that the next one will be next Tuesday, not the typical Wednesday, but it'll be next Tuesday, the 19th of January, and it'll feature Professor Rick Hasson and Ben Ginsberg, What Has to Change to Protect Our Vulnerable Electoral System. It'll be moderated by NPR's national election editor, Pam Fessler. Thank you so much for joining us. It's wonderful to be with you again for America at a Crossroads. Once again, next Tuesday at 5 o'clock Pacific time, right here. Thank you.